Hi, and thanks for joining this webinar on the development of the UK's 2024 to 2029 Antimicrobial Resistance National Action Plan. I'm Jen Dow, and I'm the DEFRA Coordinator for the current Antimicrobial Resistance National Action Plan, which I will refer to as the AMR NAP, or NAP, for the rest of the talk. Today, we're going to be focused on the animals, plants, food and environment elements of the new AMR NAP. However, there are lots of activities going on across the UK to develop content in all areas of the AMR NAP. In this webinar, I'll give an overview of the UK's current AMR strategies and the key activities that contribute to this. I will talk about the key principles of the next AMR NAP. I'll then talk about all the work that's gone on so far into shaping the content of the new AMR NAP, including priorities that have been identified relating to animals, plants, food and the environment. Finally, I'll outline how you can feed back on this process and contribute to the next AMR NAP. In the UK, we have two key strategies which guide the direction of AMR mitigating activities in the UK, and these were both published in 2019. The first of these is the 20-year vision for AMR, in which we set out our ambitions to contain, control and mitigate AMR by 2040. A key part of this vision is the development and implementation of a series of AMR national action plans, and we are delivering the first of those now. This NAP ends in early 2024, and work to develop the next NAP is very much underway. This is what we will be focusing on today. Within the 20-year vision, there are 9 ambitions which set out the activities that we will conduct in order to contain and control AMR by 2040. Obviously, work in the One Health spectrum, alongside those in animals, plants, food and the environment, contribute to many of these ambitions. And we lead on many of these ambitions too, such as protecting animal health and welfare and minimising environmental spread. The current 5-year National Action Plan has 3 key content areas designed to support delivery of the vision, and these include reducing the need for antimicrobials in animals and humans, reducing infections in humans and animals, and minimising environmental spread of AMR, as well as investing in innovation of new therapies, vaccines and diagnostics. We take a variety of approaches to achieving this, including capacity building, surveillance activities and funding, such as the Fleming Fund. The next AMR NAP will build on the progress that we've had to date, with many of our key activities carrying on into the next NAP. As I've mentioned previously, the next AMR NAP will be guided by the ambitions that are set out in the vision. We will be taking a One Health approach to the next NAP, as we have in our current NAP and as we have in the vision, because we recognise that there's a clear connection between the health of animals, plants and the environment. The plan will be UK-wide, and colleagues across the UK Government and Scottish, Welsh and Northern Irish governments have been involved in every step of the process so far. However, the scope of the AMR NAP is beyond the UK, and we have a number of activities including overseas development and international advocacy, to ensure a collaborative global approach to addressing AMR. We always wish for our policy work to be evidence-driven, and the development and delivery of the AMR NAP is no exception. We've been seeking expert opinions since the beginning of the AMR NAP and its development, and we will continue this throughout the implementation of the NAP. Within the AMR NAP, we will also have targets which will help us to quantify when we've made progress towards our goals. Additionally, we will aim to align with existing strategies and join up with strategies that are being developed to give a collaborative approach across government. Finally, we will ensure accountability with cross-government delivery boards to ensure progress is being consistently delivered. To summarise the work that's gone on so far, we began work on the new AMR NAP in summer 2022, with establishment of a specific project team which has representatives from key UK government departments, including DHSC, UKHSA and DEFRA, alongside representation from the devolved administrations. Following the formation of this team, a series of content development has been conducted, with external and internal stakeholder engagement, including a public call for evidence and various workshops and interviews with experts both within and out with government. We are still in the content development stage, which is likely to conclude around about autumn time to allow us to draft the narrative of the AMR NAP. Finally, the written NAP will be scrutinised by government and key expert stakeholders before being approved by ministers. We aim for the AMR NAP to be released in early 2024 to coincide with the end of our current National Action Plan. Before we delve deeper into what is likely to be in the next AMR NAP, let me outline some of the terms that I'll be using and set out the structure for our next AMR NAP. Within the NAP, we will have outcomes, commitments, and targets. The outcomes are goals we wish to achieve by the end of 2029. The commitments are the steps which we will take to help us meet those outcomes. Underneath these commitments, we have SMART deliverables, which are going to be the specific actions that organisations take that will help them meet the commitments and ultimately the outcomes. Finally, we have targets, which are a measurable way to assess success. Our current NAP is very commitment heavy, and the next NAP we're hoping to have less commitments, which are much broader and can capture a wide range of activities. We hope this better suits not only the UK government in their delivery of the AMR NAP, but also the public in understanding what is going on. The first step of our content development was a public call for evidence, which ran from November 2022 to January 2023, which resulted in 200 responses from professional organisations, individuals responding in a professional capacity, and individuals responding in a personal capacity. Of these responses, 43% of those identified as sitting outside of human healthcare, and there was good representation from across a variety of sectors. From the responses, some key themes emerged from the opinions shared and reflected, and these reflected both the reality of AMR and the public perception of AMR. Inappropriate use, both in humans and animals, was considered a key driver of AMR, and that's a cross-cutting issue that has been central to our current strategies. Agriculture was also considered to be a top driver of AMR by our responders. In addition to that, of the many areas that need more attention, agriculture and environment featured amongst the top to focus on. Finally, when considering the progress that's been made, many responders highlighted that the 55% decrease in antibiotic use in food-producing animals in the UK was a success that we needed to maintain in the future, and we are very keen to do that. Obviously, there's far more detail across these 200 responses that we received, and if you wish to know more about that, the results from the public call for evidence are now available on gov.uk's AMR collection, which you can find in gov.uk. From the public call for evidence, alongside engagement with internal government experts, primarily through interviews, we found that there's three key focus areas of our current AMR NAP are still widely thought to be the areas we should be focusing on in the new NAP. And just to highlight, these are reducing the need and unintentional exposure to antimicrobials and AMR, optimising the use of antimicrobials, and investing in innovation, supply and access. So these three pillars will remain key in our next AMR NAP. From all the work that we've conducted, we've identified 9 outcomes that we wish to achieve by the next AMR NAP, which are summarised here. Of particular interest to those watching this webinar will be the intention to ensure the UK workforce is supported to tackle AMR. We wish to engage with the life sciences sector to develop AMR evidence and solutions, and also want to promote the appropriate use of antimicrobials in all sectors, amongst the other things that we're working on. To achieve these outcomes, DEFRA, its executive agencies and arm's length bodies will work to support vets to prescribe responsibly through engagement activities, continued professional development, and also the provision of guidance. We'll also work to support farmers and reduce the need for antibiotics in their animals through initiatives to support health and welfare. We also want to improve upon our current surveillance of AMR particularly with respect to joining up of surveillance data, as well as bringing together the people who conduct that surveillance. We'll continue to work on the global stage, focusing on advocating for the reduction of the use of antimicrobials in animals and plants globally. In addition to these priorities, a big focus of the commitments will also be on filling knowledge gaps, which will require us to expand our network of experts and invest in research. Of particular interest will be the risks of AMR from raw pet food, the role of wildlife in AMR transmission, and also the expansion of our understanding of AMR coming from ready-to-eat and plant-based products. Following on from filling evidence gaps, it's worth noting that the way research is presented and delivered through the AMR NAP is going to change. We've taken on feedback from researchers both within and out with government that the research needs for AMR need to be clearly identified. Research is the cornerstone of the work that we do and is needed to ensure that our policies are evidence-based. In order to do this, we'll have firm commitments from the UK government to support capacity and resilience in the research community. This will include initiatives such as UKRI's new transdisciplinary networks, which open in September, which is £10 million to support networks of different AMR colleagues working in different areas. To clearly convey what the UK government needs in terms of AMR from external researchers, we will be publishing a research top 10, which will give clear steer to researchers who wish to support the government's ambitions to contain and control AMR by 2040. A number of activities have gone on so far to engage researchers, both within and out with government, as well as research funders to identify priorities for AMR. These priorities capture the activities that would most benefit the UK government to help tackle AMR. These priorities are likely to include things such as a call for the basic understanding of AMR, understanding of transmission pathways, and helping us to understand how to prevent the spread of AMR. Additionally, research on behaviour change and awareness raising will help us support evidence-based interventions to reduce AMR. And obviously, we'd be very happy to see a more robust antimicrobial therapy pipeline and development of new vaccines and diagnostics. In addition to this, we're very keen to have research on what are the most appropriate interventions and innovations for low and middle income countries, which will help support our global work. As I highlighted, we are still very much in the development stage of the AMR NAP, and we welcome your thoughts on the information that's been presented within this webinar. On the page that you accessed the webinar, you should be able to find a link to a survey to feed in your thoughts on the outcomes, commitments, and changed research approach which I've proposed here. I will be taking a tranche of feedback on the 28th of August, and all additional feedback will be analysed in mid-September. I'd encourage you to fill in that survey and share your thoughts, which will help to guide the wording and scope of the material that will be in the next AMR NAP. The survey I mentioned should only take a few minutes, and I'd encourage you to complete it while this talk is still fresh in your mind. Thank you very much for listening to this webinar. We really appreciate your engagement in this process.